Hi there, everybody. We're here to talk about a important and a little bit sad topic, which is epidemics and world health. In particular, you're going to be learning today some of the facts about the AIDS and Ebola epidemics that have affected Africa. The presentation will be explaining two of the most harmful diseases affecting Africa in the last 20 years. The first is AIDS, which is also known as HIV, and the second is Ebola. For each of the two diseases, we're going to be going over some definitions, some history, and some statistics. We'll talk about the impact of the disease, and then we'll talk about what can be done to prevent or to treat the disease as people try to deal with the epidemics. Let's start with some basic definitions. These are the definitions that will be coming on the quiz. You guys are having a quiz Friday, or in some cases on Monday. The first definition is the word epidemic. An epidemic refers to the rapid spread of any kind of an infectious disease through the population. Epidemics tend to happen quickly, and they tend to be serious. If you just have a few people getting sick, it doesn't really count as an epidemic. Transmission. Transmission is the medical word that describes how a disease is passed from one person to another. So you can have a fast transmission, or you can have a slow transmission. You can have transmission can be easy, or transmission can be difficult, depending how infectious the disease is. Incubation period. The incubation period refers to the amount of time that passes from the time that you first catch the disease until you start to get sick, when you start to show some symptoms. You'll see the difference that AIDS has a long incubation period and Ebola has a relatively short incubation period. Virus. A virus is a microscopic particle that can infect your cells. We learned about those in the brain pop videos. Both Ebola and AIDS are caused by viruses. There are other diseases that are caused by bacteria or by microorganisms such as protozoans. The immune system. Oh, it seems I have this repeated. The immune system is the part of the body that fights off diseases to keep you healthy. The immune system partly is your white blood cells and also your lymph systems, and it's in your blood and in your bones. Hemorrhage. A hemorrhage is when you have heavy bleeding inside your body, and it happens when your blood vessels break, and it's also called internal bleeding. Hemorrhaging is very serious. All right, so those are 1, 2, 3, 4, 5, 6 words that you need to know for the quiz. Epidemic, transmission, incubation period, virus, immune system, and hemorrhage. Let's talk a little bit about the history of the AIDS disease. AIDS first appeared in the 1970s and the 1980s. It was a mutation of a virus that they believe was housed in primates in Africa. AIDS is a virus that spreads through bodily fluids. It can be transmitted through sexual contact. It can be transmitted if you get a blood transfusion that has infected blood, or you can get it by sharing needles with an infected person. That's why AIDS often is a big problem for people who are drug users. Since it first appeared in the 70s and 80s, it has impacted people on all continents. There have been hundreds of thousands of people in the United States, people in Europe, of course in Asia and in Africa that have been affected by AIDS. Symptoms. AIDS has a very long incubation period. When you first get exposed to the virus and you catch it, you're not going to show any symptoms because the virus is busy replicating itself inside your body, but it happens relatively slowly. The AIDS virus attacks your immune system. It attacks the cells that defend you from disease. So what actually happens is that the HIV, which is the human immunodeficiency virus, the name of the virus itself does not kill you. It's the effect on your body. It destroys your ability to fight off disease. So what happens is when you start to have AIDS, you'll start to get frequent colds and you'll have breathing problems, infections in your respiratory system, in your lungs. You can get sores. It will eventually lead to pneumonia, and you can die from any of those things. It just generally makes you very unhealthy, makes you weak, and it's a very slow process of decline. You can live with AIDS for many years, and it can be kind of like a long, slow decline. It's not very pleasant. Okay, let's talk about some statistics. These are statistics as of 2013. And as you can see up here, that there are today an estimated about 35 million people who are infected with the AIDS virus. Um, this is a problem because infection is continuing, and in 2013, it's estimated there were about 2 million people who became infected for the first time, and about 1.5 million people who died from the virus. So it's a relatively large-scale disease in the millions of people. It's not evenly distributed throughout the world. As you can see up here, the area with the most impact of AIDS is in Africa, particularly in the southern part of Africa. About 25 million people have AIDS in Africa, which is almost 5% of the population. If you look at Asia, Asia also has a large number of AIDS victims, which is almost 5 million, but because Asia's population is so high, it's a much lower percentage. It's under 1%. Um, and if you look at the deaths by AIDS, you can see that Africa is the most affected, about 1.1 million out of the 1.5 million AIDS deaths in 2013. So it is disproportionately affecting Africa, as we can see. Here's just a world map that it shows you the same information, and you can see that Africa, sub-Saharan Africa, about 25 million. You do have in North America and in Europe about 2 million. In Asia and the Pacific about 5 million. In Eastern Europe, Central Asia about 1 million. Latin America about 1.5 million. And AIDS in the Caribbean about 1/4 million. That's where we get our total of 35 million people affected. But you can see it does affect people around the world. It's a disease that generally you wouldn't think would be affecting children because it's usually a sexually transmitted disease. But the reality is that many children acquire AIDS from their mother. They can get AIDS if their mother has AIDS when she's pregnant, or they can also get AIDS transmitted through the mother's breast milk. So you can see this is the big figure here, that you have almost 3 million children who are AIDS infected, HIV infected in Africa. And this is a great tragedy because many of those children will not survive to their adult years. Without the treatment, they're going to die. Here's the estimated deaths. I think we saw this figure before. You can see Africa with over 1 million deaths in 2013, Asia and the Pacific about 250,000. About 11,000 people have been victims of AIDS in 2013 in the Caribbean. And here's our new infections. You can see that of the 2 million people who were newly infected with HIV in 2013, the vast majority of them, again, are in Africa or in Asia. Now, if you break it down by HIV infections per day, in 2013, it says about 68% of the new infections do occur in sub-Saharan Africa. And of those 6,000 daily, about 700 children each day are infected with AIDS, and leaving about 5,200 who are over 15. Right. About half of them are women, and about 1/3 of them are young, between the ages of 15 and 24. Let's talk about the impact on society of AIDS and HIV. The AIDS virus is particularly difficult because it tends to affect people who are in their working years. AIDS is generally a disease of younger people. This causes incredible damage to the economy because you have, for example, if 20% of the people are infected, you're going to lose 20% of your workforce in their prime working years. It's of course extremely difficult for families and for communities if you have large numbers of people infected. And one of the saddest parts is that AIDS creates orphans. You often have parents who then contract AIDS and die, and leaving the children without anyone to care for them. If you have aunts and uncles who are also infected, then you're going to have entire communities where you have a large proportion of orphans. The children who are infected, as I said, they tend to be infected while they're inside their mothers through the umbilical cord and the shared blood supply that they share with their mother, or they could be infected after they're born when they're breastfeeding. When you have children with AIDS, it's very devastating for the community as well. Treatment. Uh, Actually, today, if you get AIDS and you live in if you get infected by HIV and you live in a country with good health care, there are quite a bit of treatments that are available. In general, the medication tends to be expensive. It could cost as much as $10,000 to $15,000 per year. But if you are HIV positive, you can live a pretty long life. There's a very famous athlete named Magic Johnson who was diagnosed with HIV in 1992, and he's still alive and living a very healthy life. But that's because he's been able to afford the medical treatment, which is generally not available to people who are poor. If you look particularly at the case of Africa, the thing that most would affect this epidemic and help with the prevention would be if they were able to produce more education for people to educate the people about how to avoid contracting the disease. Again, it's primarily a sexually transmitted disease, so in order to do that, you have to change people's behavior so that they are to having sex safely or not having sex with people that they are could be risky for them. So in countries that are poorer, that have poor education systems, it becomes even more difficult to prevent this because it's hard to get people to really understand exactly how this disease is being transmitted and how they can avoid passing it on to others or acquiring it themselves. Now, let's talk about Ebola. Ebola's been in the news a lot because of the big outbreak they had in West Africa. Ebola first appeared in 1976 in the Congo. Ebola is probably began as a mutation of a harmless virus that was carried by monkeys. In the very initial outbreak, about 53% of the people who got sick immediately died within a couple of weeks. And ever since then, there have been occasional outbreaks even after every so often after 1976. The most major outbreak happened in West Africa in 2013 and is still being dealt with. The countries most affected are Liberia, Guinea, and Sierra Leone. And over here you just have a computer graphic of what they think the Ebola virus looks like under extremely high magnification. So here you have a map of the Ebola outbreaks in Africa since 1976, and the region that's been affected right now is right here in West Africa. You can see these three countries. A high number of deaths in the last 2 years, particularly in Guinea, Sierra Leone, and Liberia. Impact. Well, if you do contract Ebola, you have about a 50% survival rate. There's a 50% chance that you're going to die. The symptoms that you get are fever, cough, and then within a week you'll start to have internal bleeding or hemorrhaging. Ebola is transmitted through body fluids, blood, saliva, those kinds of things, not through the air. So actually it's extremely dangerous for the doctors who are treating the patients. Doctors are highly at risk to contract Ebola when they are treating patients. And so you can see that a lot of the medical workers, if they have this kind of equipment available, that's the way that they can try to keep themselves safe when working with Ebola patients. Ebola is so deadly, it's such a high chance of dying in that if you catch it, so it causes panic in people, and it can disrupt the society, which has happened a lot in West Africa. There are people scared and people afraid to go out the house, and people can't go to work, and it has had a very bad impact on the medical community because so many doctors have become sick and died that medical help is just not available, even to the small amount that it usually is in such places. In terms of prevention and treatment, there is currently no cure for Ebola. You get sick, you can get taken care of, but there's no medicine you can take that's going to kill the virus, and there's no vaccine at the moment that you can take to prevent catching it if you get exposed to it. They are working on a vaccine which may be available in sufficient quantities by 2016. The only way that they can prevent this disease is by isolating people when they get sick so that the disease doesn't spread. So you have to have the Centers for Disease Control and Prevention put into place procedures to isolate people and to try to keep the people who are sick from coming in contact with anybody. Let's take a look here at a comparison of Ebola and AIDS and how they've affected Africa. First of all, you can see that both AIDS and Ebola are caused by a virus, which is why I asked you to watch the brain pop on viruses. Both of them are spread through bodily fluids, and in the case of Ebola, it's usually the blood of a sick person, because Ebola patients do have sores and they bleed. Okay? Now, Ebola is usually spread through blood either to a doctor or a caregiver. Somebody who's trying to take care of a sick person is highly at risk for getting sick themselves. AIDS, on the other hand, is usually spread through sexual contact. And the person who is contagious with AIDS, who's infected with HIV, may not have any symptoms. If you're infected with HIV, no, the other people around you may not know that you're sick, and you may not know that you're sick. So it is possible for you to spread that disease to other people without knowing it. And that's partly because AIDS is a disease that kills you slowly. When you get HIV, you may not be sick for months or even years, but you are carrying the virus and you're able to transmit it to others. On the other hand, Ebola, once you're exposed to Ebola, you can get sick within about 2 weeks, and once you get sick, you don't last long. You either get better or you die. Because of some of these reasons, AIDS is a much more serious epidemic in the sense that it's affected millions of people, whereas Ebola has only affected numbers in the thousands. Ebola is a little bit scarier because it kills you so quickly, but in reality, AIDS is a far more serious problem. You can see that in the countries affected by Ebola, even in the most devastated countries, it's less than 1% of the people who've been infected, whereas in some of the countries in southern Africa, the infection rate for AIDS is over 20%. Which means about 1 in 5 people are carrying the HIV virus. Some of them are sick and some of them are not, but they're all able to pass it on to others. Ebola itself has been concentrated in recent years mostly only in West Africa, whereas AIDS is present all over the world, but as we saw, the large proportion of the cases happen in southern Africa. Let's conclude the presentation by taking a look at some basic facts about this. We do know that there are many health problems in Africa, including malnutrition, diseases like malaria, which are carried by mosquitoes, and others. The problems that they have with health in Africa are usually made worse by the poverty of many African countries. It impacts their ability to provide adequate health care, sanitation, and also to educate the people about how to prevent the spreads of these types of diseases. Ebola and AIDS are two viruses that have heavily impacted Africa in recent years. And the AIDS epidemic in particular is impacting millions of people and disrupting entire societies. It's something that the World Health Organization has been working heavily on in the last 10 to 15 years. They are making some progress, but there's quite a lot of work left to be done. Before I turn off the recording, I do want to tell you that you can find more information if you look up the World Health Organization. Also, I suggest that for the test, you study the brain pops that we've seen. There's a brain pop on Ebola, there's a brain pop on viruses, and there's a brain pop on AIDS. If you're also wanting to remember some of the vocabulary from Invictus, the brain pop on apartheid, you might want to review that one as well. Have a great day, study hard, and we'll see you next class.